As for the ultrasound, it was very interesting because of my background treating varicose veins and examining tubes and having a probe in my hand for thousands of examinations and treatments. I thought it was just the obvious approach to have a look at men who have had vasectomies, and I started examining my own patients after the vasectomies and seeing how things changed. And then I started looking at patients when I was doing reversals and comparing the two patients, and then I started getting a feel for certain factors that really were positive as indicators for success. Now, you can, it's generally accepted that the longer the interval from the vasectomy to the reversal, the lower the chances of success. But I started seeing trends where patients could be over 30 years and have had a vasectomy, and they can have some very positive changes that actually made their success rate much better than someone who had a badly performed vasectomy, even 6 months interval between vasectomy and seeking a reversal. So the ultrasound was absolutely wonderful from that point of view. And as I started using the ultrasound, I started bringing patients to theatre as I was mapping and assessing and planning surgeries. And Professor Owen was astounded over those 10 years how much information we could glean from those studies, and then to come in and say, Prof, we're going to find X, Y, Z, and almost certainly every single time we found exactly what it was that we needed. Professor Owen's criteria for a very, very long time was to join the vas to vas if there was fluid flow at the time of the vasectomy reversal, when we freshened up the end attached to the testicle. Well, I can actually tell patients if they're going to have flow of fluid at the time of the ultrasound, and I don't even have to make one single incision. Then we can determine if the other structures have got good integrity to give us the best possible chance of that reversal vas to vas working. We can get an idea if we have to do a bypass procedure and how successful that might be with the type of tubules that we find, and are they going to be nicely reconstructible. So this information has just been absolutely fantastic, and it's been wonderful to have patients do their homework, and patients to come from far and wide, even from overseas. Many patients who've had failed vasectomies, failed reversals, a failed management for pain syndrome, and it's just been that extra wonderful tool in the toolbox to give patients the best possible chance in terms of planning the best outcome.